country action plans, going from political commitment to strategic partnerships and to country engagements with impact. I'm very pleased to be here with my co-chair, Dr. Anurita Baines from UNICEF. And we will have a series of different speakers. We will be introducing each of our speakers as they come forward, and their bios will be shared on the video conferencing. So don't worry, you'll get to know our speakers very well. Today, we want to really tell you where we've come in the last, I guess 18 months, almost 2 years, where the original ideas about the Global Alliance were brought forward. We had a meeting in Montreal, then again had a launch with the political leadership, such as our Honorable Minister from Zimbabwe, where countries committed, 12 committed countries to the Global Alliance around 4 pillars: closing the testing and treatment gaps for children, closing the treatment gaps for pregnant women and breastfeeding women, preventing HIV among women and adolescent girls, and addressing rights, gender equality, and social barriers. All of this today, we want to take a pause, take a break, see where we're at, and have a dialogue to see how we can drive that momentum further. So we want this to be as engaging and as interactive as possible. Very excited that we have now active West and Central Africa and East and Central Africa hubs, and those hubs and those countries are all represented today. So with this, I'd like to move on to our very first speaker, if I could. And this is about introducing our very honorable Minister of Health and Childcare, Dr. Douglas Mombeshwara. And we would like to hear from you, your perspectives on what are some of the actions that have taken place in Zimbabwe since the Dar Declaration was signed on the 1st of February in 2023 in Tanzania. And if you could also put that into the context
the magic woman. Good afternoon. I can see you're all very ready for this session. Let me say, as Zimbabwe, we are fully committed to implementing activities targeted at ending AIDS among children by the year 2030. I recognize the disparities that are affecting treatment for children in my country, where as at the end of 2022, only 69% of children living with HIV were on antiretroviral treatment compared to 95% of adults on antiretroviral treatment. And I think this is unfair. It's actually injustice to our children. In response to these disparities, my ministry developed its Global Alliance Country Work Plan, which was presented at the high-level meeting in Dar es Salaam. In a show of high-level political commitment to the Global Alliance, Zimbabwe was represented by our Vice President at that meeting. Since the launch, the Global Alliance Work Plan has been fully costed and implementation accelerated in partnership with UNICEF, WHO, UNAIDS, and other funding partners and civil society organizations, including networks of people living with HIV. We recently convened a meeting of the Global Alliance country team to take stock of progress in implementation of the Global Alliance Work Plan. I'm pleased to report that progress has been made in the following areas. Zimbabwe as a country has successfully domesticated the Global Alliance and to end AIDS in children by 2030 with high-level political commitment. My ministry has been progressive in moving from dual elimination of mother-to-child transmission of HIV and syphilis to triple elimination of mother-to-child transmission of HIV, syphilis, and hepatitis B virus. At the pre-World AIDS Day event on 30th November, the triple EMTCT plan was successfully launched. I'm also pleased to report that on the 2nd of December 2023 in Victoria Falls, Her Excellency, the First Lady of the Republic of Zimbabwe, Dr. Auxilia Mnangagwa, hosted African ladies at a high-level organization of African First Ladies for Development, OFLAD, meeting on ending new HIV infections among children by 2030. With support of our frontline healthcare workers, people living with HIV and implementing partners, we have scaled up innovative strategies to find children living with HIV, linking them and retaining them on antiretroviral treatment using community-based strategies. In order to increase the third 95 of the UNAIDS 95, the country is supporting scale-up of peer support mechanisms, including use of networks of people living with HIV to keep children on treatment to achieve viral suppression. To date, we have rolled out child-friendly formulations with more than 87% of children on DTG-based formulations. Our target is to reach 98% by end of this year, 2023, a target which is attainable. Finally, we are committed to preventing new HIV infections amongst adolescent girls and young women using innovative pre-exposure prophylaxis interventions, including rollout of the long-acting cabotegravir. My ministry, in collaboration with National AIDS Council, other line ministries, and our development partners, are now seized with interventions to address gender-based violence and other structural barriers preventing us from reaching our targets. I thank you.
Thank you very much, and I'm sorry we're going to have to share our microphone. Those were really inspiring remarks and huge success, and I think we also have to acknowledge that attaining and reaching 98% of children with DTG, triple elimination, and certainly having communities and peer support at the base of your work is inspiring, and I think other countries will want to be doing the same. And I think it's the evidence of this global alliance is that countries are leading first, creating their plans and moving forward with their plans. So we're very thankful for that. So now I'd like to be able to welcome Ms. Maximina Jokonya, who's representing Y Plus and the community. And I'd like to ask you if you could please tell us about the role that communities are playing to push the Global Alliance agenda, noting that you're also engaged in some of the development of country action plans as they are being rolled out. So over to you. You have a mic now? Thank you.
I do. Thank you so much, Dr. Meg, and thank you so much, Honorable Minister. My name is Maximina Jokonya. I am a young mother, proudly living with HIV. So for me, I'm someone who is really close to Global Alliance goals, objectives, and what we want to achieve, because I've witnessed firsthand in terms of if we put systems, if we put services in place, we are able to end AIDS by 2030. And my son, who is HIV negative, is a testament of what we can do more, and other young women who are in the communities who might not have this platform that we have today, that I'm really fighting for today. I am representing the 3 global network, which is Y Plus Global, ICW, and GNP Plus. Thank you so much for having me today. So in terms of how communities were engaged in the Global Alliance agenda, I think we can all resonate in terms of what we are trying to push to say, without communities, we cannot achieve anything. Let communities lead. That's what we want to achieve. We know that for everything to really, interventions to be more, ownership as well as adapted in communities, we need to make sure that communities are the ones that are on the forefront. So for us as communities, we were involved from the very start of the Global Alliance conceptualization, where we also engaged in the actual concept note writing, where we gathered as communities to really get insights in terms of what do we want to do differently when it comes to pediatrics, children, young mothers that we really want to target. So this is where we came from. And initially in the concept note, we didn't have Pillar 4, which is focusing on global community engagements and community interventions. And we really recognize that we cannot achieve the other 3 pillars that are focusing on, interventions and services without the community component, which is looking at how do we promote human rights, how do we make sure that we are achieving gender equality, for example, but also making sure that communities are the ones driving the services that are driving the interventions at the ground. So this is where we're also engaged. We're also engaged in different platforms in terms of the structure that Global Alliance do have. We are sitting at a steering committee. We are sitting at advocacy group. This is at global level. We come to regional. The regional hubs also have community representatives, and we made sure that the communities that are sitting there understand the context across the 12 countries that Global Alliance is also focusing on. And also the most important one is around the country level, because most of the times we love to do interventions from global to local, but this time we changed the gear and we said it has to come from bottom up. That's the only way that we can achieve our goals. So here, this is where we came from. We engaged our country local networks, people living with HIV, and other allies that are supporting the work of children, adolescents, young mothers, and also the young people in general. So as the 3 networks, we led an initiative where we really wanted to then have what we call Global Alliance champions. So these are well-articulated, seasoned advocates who are able to champion the voices of our children and peds that has been missing in the HIV response for quite a long time. So this is the process that we went through, so that we make sure that even in the country teams that the Honorable Minister was also talking about, they are also engaged, they are also contributing to the country plans that have been put in place. And I'm happy to say that we now have champions that are going to be representing us, that are diverse. We can talk of healthcare workers, we can talk of grandmothers, we can talk of young mothers, we can talk of young fathers as well. So we've made sure that there is a diversity of how the voices of children and peds are going to be amplified at the end of the day. So these are some of the structures that we have put to make sure that we are not only doing lip servicing, because nowadays it's more about what are we writing in our documents, but on the ground, we are not doing the actual work. So Global Alliance, we are making sure that we are very intentional, that the communities are the ones that are driving the agenda, that the ones that are influencing what is happening on the ground, that they are providing guidance and direction, and making sure that the priorities of children, of pediatrics, of young mothers are being really intentionally attended to, and the services that they need, they are receiving the services. So I think this is what some of the things that we have managed to really accomplish as communities. We are going to continue to push as well, I just want to mention that we're also part of the Montreal launch, as well as the DAR, launch as well, but also some of the accountability work, because we also want to be accountable, right? The work that we are doing, how are we going to make sure that the communities are also benefiting? So we are part of the accountability framework group, where we're going to say, okay, this is where we started. In 2023, how far have we gone with the Global Alliance 4 pillars? What more else can we do? Is the community really being intentionally engaged? Are they the ones that are leading on the ground in collaboration with ministries, in collaborations with our wonderful funders? This is what we want to see at the end of the day. Collaboration and partnership is the only way to go. And I think for this is where we also find our lovely funders like Viv, who have really supported the Global Alliance champions to be able to then implement work on the ground. I think from me, I can talk a lot, Meg. So let me end here. Thank you so much. Over to you.
Thank you. And you've said so much so well, but I think what you're showing us is that we knew going from the global plan to the 3 frees, something had to be differently organized. And the thing that we all thought needed to be differently organized is that we would have real champions. And I love the fact that there are Global Alliance champions and that you're going to be holding us accountable, ministries accountable, everyone accountable, and that we'll be able to show that this time around we're making those changes that are going to stay and get us to our targets for 2025 and 2030. So I really appreciate your really helpful comments and leadership in this space. So now we will be shifting to a video message on behalf of the Ambassador John Nkengasong from the PEPFAR office. So let's see if we can have that message come up. Thank you very much.
Good afternoon. Honorable Dr. Douglas Mombashora, Minister of Health, Zimbabwe. We commend your leadership in realizing the DAR commitments for Zimbabwe. Ms. Winnie Byanyima, UNAIDS Executive Director and Under-Secretary General of the United Nations. Thank you for convening us here today and for facilitating the creation and implementation of the Global Alliance to End AIDS in Children. Distinguished colleagues, I'm Dr. Emily Kainedu-Kubo, and I serve as the Deputy Global AIDS Coordinator for Program Quality for the U.S. President's Emergency Plan for AIDS Relief, PEPFAR. I am pleased to provide remarks on behalf of Ambassador John Nkengasong, U.S. Global AIDS Coordinator and Senior Bureau Official for Global Health Security and Diplomacy, on the importance of translating the Dar es Salaam political commitments to end AIDS in children into action. Since the launch of PEPFAR in 2003, over 25 million lives have been saved globally, over 5.5 million babies have been born free of HIV, and we are working to end AIDS as a public health threat by 2030. These achievements, in large part, are thanks to partner governments, stakeholders, and communities that have been working collaboratively to implement the action plans across the Global Alliance countries. Through your commitment and ongoing efforts, we have made remarkable progress together towards eliminating AIDS as a public health threat. Across the HIV clinical cascade, results for children continue to lag behind those of adults. To see meaningful improvements by 2025, it is imperative that country action plans are fully implemented by galvanizing political support and community engagements and prioritizing the development and use of accountability frameworks. Over the past 20 years, PEPFAR has supported countries to provide quality care and treatments to people living with HIV and prevent new HIV infections. To address gaps among children and other priority populations, our activities will promote testing, optimal treatment and care for children, and eliminating vertical transmission through preventing, detecting, and treating new HIV infections. Through special initiatives like the recently announced Safe Births Healthy Babies, we aim to accelerate progress to eliminate mother-to-child HIV transmission and reduce maternal mortality in PEPFAR-supported high HIV burden focused countries. In partnership with the Global Alliance, PEPFAR will support implementation of each country's action plan, and we remain committed to empowering and supporting partner countries to provide quality HIV prevention and treatment services for pregnant and breastfeeding women and children as we work to achieve the 95-95-95 goals by 2025 and end AIDS as a public health threat by 2030. Thank you for your dedication and continued efforts to improve maternal and child health outcomes. Closing the gap for children will require a steadfast commitment and holding ourselves accountable. PEPFAR looks forward to continued partnership with you as we work collaboratively to achieve a healthier future for pregnant and breastfeeding women and ending AIDS in children. Thank you.
So we thank the ambassador, PEPFAR, and the office for that very supportive message. And I think what it exemplifies is that the Global Alliance is not just one institution or two institutions or three. It's a conglomeration of many institutions coming together with the same goal. And we're very thankful to have the support of PEPFAR alongside of that, as well as Global Fund and many of the other partners who will be having their conversations this morning. It's now a time where I would like to ask a few questions to those in the audience. There's two members in particular who we'd like to have a comment from. And we do have to also say that we were hoping that Dr. Yogan Pillay would be able to give us his comments on behalf of the Bill and Melinda Gates Foundation, but he had to return to his home on short notice. But I'd like to open this up and give a special thanks to Ms. Kathy Ferrier, the head of Positive Action ViiV Healthcare, for the dedicated support that she's been providing to the Alliance community advocacy work and the breakthrough partnership that works in selected countries, including Nigeria, Mozambique, and Uganda. So if you could perhaps give us a few comments about your contributions, your views, and how you feel we can move forward for a successful global alliance. Thank you.
Thank you. Thanks, Meg. And thank you to everyone in the room. At ViiV, it's a big strategic priority for us to work on ending pediatric AIDS, and we try and support different initiatives from community, from the voices of young women, and also then partnering with PEPFAR, Global Fund, etc. And it's our absolute privilege and pleasure at ViiV and Positive Action to support the Global Alliance. I think we all know what the gaps are in terms of supporting children and getting more children into treatment and care, and closing those gaps. We need everybody. As I say, we try and support at all levels. But we're delighted to be here and delighted to support the Global Alliance.
Thank you very much. Appreciate it. And we know that we have many organizations in the audience that we may not have your moment, but to know that you're part of the Global Alliance, we feel it's all comers, because in this case, to end AIDS in children, we need everybody at the table. Now I'd like to ask Dr. Martha Mukanega, the Associate Director of EGPATH, if she could identify some of the critical gaps from her perspective and what EGPATH is working towards in the Alliance in the countries in which you are working. Thank you.
Thank you. Thank you. As EGPATH, we are really excited to be part of the Global Alliance. And when we look at that critical gap, we take into consideration the high political commitment that is already shown across the countries. We also look at the exercise that has been completed to come up with specific country gaps. And those gaps have informed the development of the country action plans. So to be able to achieve the goals, then there is really a need to look at the financial resources. The financial resources, they will be needed to to really implement those country-specific action plans, and then that implementation will lead to achieving those goals. Now, the financial resources will not be sufficient. They will need to be used with efficiency, and then make sure that those resources are affected to strategic and evidence-based interventions, so that those limited resources really lead to implementing those actions plans, and then achieve the defined goal. Thank you.